other conditions that I commonly see at my clinic is called mood disorders. Now, there are different types of mood disorders. Now, when you talk about mood disorders, you might have heard people talking about their mood as in day-to-day reference, that I'm feeling crap today or I'm feeling great today. Does it mean that everybody has got a mood disorder? No. Mood disorder is a specific condition whereby the mood pervasively is disturbed. Now, it can be in the form of a low mood, which is a condition called depression, or it can be in the form of a high mood, which is called mania or bipolar mood disorder, if there is a combination of both. So, I'll take you through both of these gradually. So, when we talk about low mood, now people can experience low mood for various reasons. Somebody having lost their job, somebody having missed their flight, somebody having had their argument with their partner, or somebody not been able to achieve their potential as they wanted to. Now, this could be a very temporary change in their mood, not necessarily a mood disorder. For a clinical depression to be diagnosed, a person has to have not only low mood but other set of symptoms over a period of 2 weeks. These other symptoms could be in the form of lack of motivation, lack of energy, lack of concentration, difficulties in their sleep, either sleeping excessively or not being able to sleep at all. Similarly, having difficulty in controlling their appetite. So, either having no appetite at all and resulting in weight loss, or eating excessively and gaining weight. Now, these sleep and appetite, if they are not typical of depression, sometimes we call them as atypical depression, whereby people eat more and sleep more, but other symptoms of depressions are equally present. Now, depression sometimes can present as agitated mood as well, particularly in young people. So, along with these symptoms, there has to be a definite impact on their functioning in various areas, whether this is about their social functioning, interacting with people, or it could be in their occupational functioning. Now, as we know that depression can happen as a result of various conditions. So, for example, certain medical conditions can give rise to depression. So, for example, diabetes, uncontrolled diabetes, or hypothyroidism, that is lack of thyroid hormone being secreted by your gland in the neck, or it could be because of certain medications that you're taking, which could be, for example, the cancer treatments, the medications involving other conditions such as antipsychotics if somebody has suffered with psychosis previously, or other medications. Now, we have to rule these out before we jump on to the diagnosis of clinical depression. Now, the depression can happen in different forms, in different severities. So, grades of depressions are mild, moderate, or severe. Sometimes depression can be complicated by the presence of psychotic symptoms, such as hearing voices or seeing things, hallucinations, or having certain beliefs that their body parts are rotten, or the world is coming to an end, or they're going to die very soon. Now, when you see somebody with depression, what comes in your mind? Sometimes people ignore it. They feel that they'll get better with the time. Sometimes they feel, oh, if things change in my surrounding, I'll get better. Not necessarily. If you're struggling with clinical depression, then it's likely that you need more help than what you think. The help can be in the form of reaching out to your family, your friends, or professionals. When you come to my clinic, I'll assess you for the presence of the symptoms of depression. We might use validated rating scales to measure the severity of your symptoms, and also look at ruling out other conditions which may present with depression, such as anxiety, substance abuse, such as use of alcohol or drugs. Sometimes people use alcohol and drugs to fight their depression. How common is depression? There are various estimates depending on what research study you rely on. but they say that depression is most common condition among the psychiatric conditions. So it can be present in the form of around 10% of population, or it could be present up to 25% of the population at various points in time. Invariably, one episode of depression is likely to happen in everybody's life at some point. It may go unnoticed if it is mild form of depression, or it may impact you severely if it is a severe form of depression. The treatments of depression include various forms such as medications, various types of antidepressants. We can discuss it when you come in the clinic. Now these antidepressants, they work because of their action on certain receptors in the brain. They adjust the neurochemical imbalance and help you fight the depression back. We also look at supporting your treatment with psychological intervention such as counseling, CBT, cognitive behavior therapy, which can help address the depressive cognitions that a person develops over a period of time. The sense of worthlessness, helplessness, or hopelessness, believing that they are not worth anything or people cannot help them and it's completely hopeless. The future is completely pessimistic. We can also look at various other forms of treatment. We could look at self-help guides. We can help you find local groups which may be helping fight depression by engaging people in different activities. Now you may have a hobby such as horse riding or joining some groups which may be useful. It's about that people in depression, they lose interest in various activities, their hobbies, their interests, they are not able to enjoy anything, and their social networking is reduced. So we try to encourage them to increase those. As I was mentioning earlier, that the other mood condition is called as mania. Now, mania is completely opposite of depression. So while in depression we see people who were completely isolated, withdrawn socially, not interacting with people, feeling quite low in their mood, in mania it is completely opposite. Here, a person can present as quite charming, quite talkative, quite overactive. They are bubbling with different ideas, their mind is racing. Sometimes they talk so fast that you cannot understand what they are saying. Sometimes they speak so fast that their thoughts are not connected to each other because they are coming up with so many ideas in their mind. They feel as their mind is like a train station. Now, when they are doing that, obviously they got lots of energy, physical energy. So they don't feel tired. Sometimes they don't feel that they need to sleep. Sleep is a waste of time for them. So the lack of sleep is one of the core symptoms of mania. Similarly, spending time in eating can be also a symptom of mania. So they can lose weight very quickly. They sometimes can self-medicate by using alcohol, drugs to control their emotions. Now, when these episodes of mania and depression are happening alternatively, or if a person is experiencing more symptoms of mania most of the time, and they experience more episodes of mania, then we call it as a bipolar mood disorder. Now, for treatment of mania per se, we can look at different forms of treatment. There are different medications which can help manage the manic episode, such as mood stabilizer, antipsychotic medication, benzodiazepine. We can look at CBT in understanding their manic symptoms when they are recovering from the episode, and then how to regulate their emotions. When it comes to bipolar mood disorder or bipolar condition, which is nearly 1% of the general population, then we look at the treatment with medications such as mood stabilizer, antipsychotic for the acute episode. So the treatment is divided into two phases, acute and prophylaxis. For the acute treatment, we look at their acute episode. We look at what episode they are experiencing. So if they are experiencing depression, we treat depression, but with the cover of with the cover of a mood stabilizer. Similarly, if they are experiencing a manic episode, then we treat with a mood stabilizer plus minus antipsychotic or benzodiazepine. Once they recover, then they just need to stay on the mood stabilizer. Then they need regular follow-up. Some medication may require regular blood test, such as lithium, while the other medication may require other regimens, such as titrating at a very slow pace. So increasing the medication dose very gradually over a period of 2 weeks or more. We look out for the side effects of these medication, obviously, and of course we try to support people regaining their potential between the episodes. So the target for the treatment in bipolar condition is that we treat the current episode, the acute episode, and then we prevent further episodes. Now, further episodes will still happen, but with the right treatment, these episodes will go unnoticed or they will not be impacting on their functioning significantly. And there will be long gap between the episodes as well, so they can function optimally. Now, it is quite important to recognize these disorders because these disorders carry a lot of complications. People can be at the risk of harm to themselves or others. For example, in depression, the suicide rate is pretty high. It's nearly 13 times compared with general population. 50% of people can attempt suicide. 25% people succeed sometimes. In bipolar mood disorder, the risk of suicide is again very high, and sometimes bipolar mood disorder runs in the families as well, so there is a risk of genetic transmission. Now, if you have somebody with bipolar condition in your family as an index family member, then there is 7 times general population risk of another person in the family having bipolar mood condition or other mood condition. Now, we have seen through the twin studies as well that there is increased risk of bipolar mood disorder, but of course it is never 100%. So it's important that we look at early identification and early treatment of the conditions. Now, when these conditions are seen, they can be seen quite early as in teenage, or sometimes they can present later in life. But it's never too late to reach out and seek help and treatment. With the treatment, the impact of illness on their life, their functioning is reduced. The chances of comorbid condition with these treatments is also reduced, and also we look at person being in control of managing their illness.